Have you ever wondered about the air you share, especially when someone nearby is coughing repeatedly? It is a natural concern, and a very important one. When someone has a persistent cough due to active tuberculosis, or TB, in their lungs or throat, they can absolutely be contagious. The risk of transmission exists when these individuals releases tiny, invisible germs into the air just by coughing, sneezing, or even talking. The reason for this contagiousness lies in how tuberculosis bacteria, called Mycobacterium tuberculosis, spread. And like many other infections, TB is transmitted through airborne particles called droplet nuclei. When an infected person coughs or sneezes, these tiny particles, which are much smaller than visible droplets, can stay suspended in the air for hours. Someone else then breathes in these particles, and the bacteria can settle in their lungs. Several factors influence how contagious a person is, including the number of bacteria they expel, how often and forcefully they cough, the ventilation in the shared space, and the length of time people spend together. It is crucial to remember that only people with active TB in their lungs or throat are contagious. Those with latent TB infection, meaning the bacteria are present but not active and causing symptoms, cannot spread the disease to others. Understanding this airborne transmission means we can take steps to reduce the risk. If you have a persistent cough that lasts longer than 3 weeks, especially if accompanied by fever, night sweats, or unexplained weight loss, it is vital to see a doctor for testing. Getting an accurate diagnosis and starting treatment promptly is the most effective way to stop spreading the bacteria. For those diagnosed with active TB, following the prescribed medication regimen exactly as directed is essential. It is also helpful to cover coughs and sneezes with a tissue, ensure good ventilation in shared spaces, and temporarily limit close contact with others until treatment significantly reduces contagiousness. A key distinction often overlooked is the difference between active TB disease and latent TB infection. Someone with latent TB infection has the bacteria in their body but does not feel sick, cannot spread the bacteria, and will have a normal chest X-ray. However, about 5 to 10% of people with latent TB will develop active TB disease at some point, making testing and treatment for latent TB important as a preventative measure. The duration of contagiousness for active TB varies, but generally, a person becomes non-contagious after 2 to 3 weeks of effective treatment, provided their symptoms are improving. This rapid reduction in contagiousness underscores the power of modern TB therapy. Ultimately, the contagiousness of a persistent cough from active TB is a serious but manageable concern. By understanding that the disease spreads through tiny airborne particles, and by recognizing the importance of early diagnosis, consistent treatment, and basic respiratory hygiene, we can collectively protect ourselves and our communities. Proactive health seeking and adherence to medical advice are our strongest tools in preventing the further spread of tuberculosis.